welcome everybody to chain analysis for DBT. This is a great skill that can be incorporated into many different frameworks and integrated, although it really kind of has developed out of DBT. It really draws from the second wave CBT of the thought record. This just definitely, the chain analysis in DBT gets much more in depth about behaviors and how that actually connects to the antecedents and the problem situations, as well as other elements. So this is a great tool for not only beginning clinicians but for very seasoned clinicians, because it's a visual representation of a person's behavior and situation from start to finish. So let's dive in and see what this involves. The first part of the chain, the first thing you want to identify as a clinician is start off by working with a client to identify the problem behavior. Probably just sticking to one problem behavior is enough for one chain. You can do multiple chains though, as you kind of deconstruct different problems that clients are having, but definitely just stick with one chain per problem behavior. Otherwise things get too many links in the chain. Let me just put it that way. After you've identified the problem behavior, then you actually jump back and create a space where there is a prompting event. In CBT, this was called the antecedent. The prompting event is what essentially kind of started off, or what was the situation that kind of blew up at the time that kind of got things going. So getting clients to understand exactly, sticking to the facts, what exactly was the prompting event. Before the prompting event is the next part of the chain, and this is where kind of the thought record, the original CBT, didn't ever hit on this, and that's why part of DBT, the evolution into the third wave, really started to look at a client's vulnerabilities and what happened even prior to the antecedent. So this is a great part of the chain analysis that you'll want to take time to work with clients on, is what actually maybe was some of the early sparks, the early things that got that led to the prompting event being so emotional or so intense. So when this person is vulnerable, as I mentioned in the course, this could be anywhere from sleep to not taking medication to some sort of substance use potentially, to something happening earlier that day. I mean, it could be any number of things that really kind of primed the pump or kind of started to heat things up prior to the event, kind of this explosion. After you've worked with a client to identify the vulnerabilities, then you move on to actually the links in the chain. So this is an important part of the chain analysis. Each step of this chain analysis should take some time. Don't speed up. Don't feel like you're in a race in a 100-yard dash. This is part of an entire session where you'll want to dig in. You'll want to explore the problem behavior a little bit. Make sure it's described very well. Describe the prompting event, the facts surrounding it. Then go into the vulnerabilities. Really, flesh that out and figure out what went on. Then when you get to the links, there's 3 links in particular. You want to explore the thoughts that the person was having as the prompting event kind of blew up or created this intense emotional experience. What are the thoughts going on? The second thing, explore what emotions the client was having and try and list those out as best you can. And then the behaviors. What exactly were some of the early behaviors that led to the ultimate problem behaviors? What were some of the initial reactions that the client began to have that then added to the problem behavior? So digging into each of those links is going to be critical, because that will help the client understand what led from the prompting event to the problem behavior, so that they can begin to understand in a very visual way what connects that chain. Then you move on to the other side of the problem behavior, which also isn't really covered in the original thought records of CBT, which is this idea of let's really analyze and look at what are the consequences of the problem behavior. So this is really the insight portion of getting clients to understand what are the unhelpful or unhealthy consequences that seem to develop or that happen after the problem behavior. This is so critical that clients begin to understand this. This also is very helpful to clinicians to see the level of insight the client has. If they just merely figure that, yeah, I have this problem behavior, but they're not linking it to what the consequences are for themselves, others, and the world around them, then we're going to, as a clinician, you're going to need to focus on developing and helping to develop that insight and explore that with clients. Let's move on to constructing a new chain. So once you've constructed the kind of the problem behavior chain, then you really introduce this concept to the client, which is, hey, let's now begin to look at what a new chain of behavior would look like. So again, you're going to start off this time, instead of describing it as the problem behavior, you're really going to label it and look at it and speak of it in terms of a healthier or helpful behavior. This is critical. You're getting the client to help use different language and knowing that what they're shooting for, not merely avoiding a problem, but developing a healthy behavior. And oftentimes in therapy, that ends up, I've mentioned this time and time again, it's very difficult for the human mind to reduce or stop what is considered kind of a negative, because you just reinforce and focus on reducing something that you're already have been focused on. You know, merely being less angry is not really effective, because you're still focused on, okay, you know, I just want to be a little bit angry, as opposed to really constructing a new chain of a healthier, helpful behavior. Once you identify that, the client has a firm kind of direction and a goal to head. Then you can begin to construct a new chain by saying, hey, let's then look back at a prompting event that would happen, and just thinking back then to that prompting event. What's the emotions involved? What might set them off? And then you're going to, again, look at the vulnerabilities. What are some of the things beginning to realize that need to be addressed prior to a prompting event that might set things off? So this gets back to, are you sleeping right? Are you eating right? Are you staying active? Are you taking your medications? Are you avoiding substances? All of those things, may serve as vulnerabilities to a client. And that could go on and on depending on the clients. So getting the client to be very aware of the things they need to be taken care of on a daily basis as the beginning of this new chain. Then, this is the key element of DBT. This is where all of those skill modules come into play. Because once we're aiming for a healthier, helpful behavior, we still have to realize that a prompting event in that person's life is going to continue to happen on a daily basis, or they're going to be involved in prompting events all the time. So it's beginning to get them to realize that prompting events are going to occur. So what are the skills in each of those DBT modules? If you remember, we're talking about mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. Now you start to help the client understand, then let's build the links in the chain of when we have this prompting event, what are the thoughts, emotions, and behaviors that your body and mind are likely to experience, and what are the skills that need to then be implemented in order to create a healthier, helpful behavior. Is this a distress tolerance situation? Is this a mindfulness situation? Is this a interpersonal relation or situation, or is this an emotional regulation? And what are some of the thinking, feeling, and behavioral skills that need to come into play that lead to that healthier behavior? And then once you've established those, it's then looking at the consequences of what then comes after the helpful or healthier behavior. And this could include repair behaviors. So it's one thing to, in the prompting event, maybe start to kind of get angry, upset. You start to kind of blow up, and then you start to implement these skillful behaviors. You have a more healthier outcome. Sometimes the consequences then require repair behavior. So it's starting to either apologize or go back to, persons that you maybe had an issue with or conflict with, or this may be just intrapersonally. It's learning how to forgive yourself, accept yourself. So essentially now it's looking at what are the consequences that came out of the helpful behavior. These don't have to be bad. In fact, it's looking at some of the healthy consequences. Maybe your relationship is strengthening. Maybe you're excelling in your job. Maybe you're developing new friendships because of the healthier behavior that you've constructed. Finally, this gets kind of back to an earlier portion of the chain, is then saying, let's not just stop at your vulnerabilities. Let's talk about an actual prevention plan that will help you with the vulnerability. So what is a plan in place to help you, for example, become active, get enough sleep, stay on your medication and take it faithfully, whatever that might be. So it's really kind of looking at this early on, kind of this very first chain of what can we do on a daily basis so that this chain starts off right, that no matter kind of what prompting event, we have a plan in place even prior to that. And this can be something such as a daily practice of those 4 modules of DBT, practicing mindfulness daily, practicing some of the distress tolerance skills early in the morning so that during the day when situations arise, the client is much more prepared for prompting events and for reducing their state, that vulnerability that they may face. One thing in DBT, in order to help with understanding these chains and doing a behavioral chain, is to have clients do what's called a diary card. So this is one of the main interventions with DBT, is a diary card. This is what one can look like. This is kind of a typical diary card. There are different versions depending on the ages of the client, but this is one that really does, I'd say, a fairly good job of what a client needs to keep track of. As you can see, this is very busy, it's very intense, but that is really DBT in a nutshell. It's really having clients understand that they need to be on top of and mindful of all these different aspects. If you look up at the kind of the top row there, if we consider it that, in top columns, you're getting clients to pay attention to what their urges are, what their emotions are, what their actions are, and if there's any sort of substance use involved. So you can see urges too. You can see here that this is really addressing stage 1, that hierarchy of targets. It's really getting those clients to make sure that they're very aware of reducing self-harm, suicide, or impulsive behavior. Those in stage 1, oftentimes those numbers are very high. In early DBT, those should be definitely low, if non-existent, before moving on to other stages of DBT, which is why they then have clients begin to identify and track their emotions. Marsha Linehan really has identified some of these emotions as being kind of at the core of emotional dysregulation and distress, such as pain, anger, shame, sadness, and fear. So clients will rate those throughout the week. As you can see, it's Monday through Sunday. They should be rating every day. What are their actions? So did they do any sort of self-harm, suicidal, impulsive behavior, or others? I'll admit I do not know what that LIA means, but I would just put other actions that are probably unhealthy in that column. Then we have substances that could include street drugs, alcohol, prescriptions. You'd want to specify if something was used, what was used. And then finally, you'll rate overall, what was the urge, the actions, and emotions for that day. As you can see, Marsha Linehan was definitely a researcher and definitely a quantitative researcher that has some qualitative aspects, but heavily quantitative so that they could track progress. So one of the things of DBT, if you were to talk about the theory of change and how you evaluate change, a diary card would be one of those elements to evaluate change, whether or not quantitatively these numbers are going down. Also, part of the diary card is to keep track of what they did well. So this is kind of the qualitative portion. It's writing down in the very solution focused portion, what did they do well during the week? So getting them to focus and write down some of those things, not just focus on, what are some of the intense things up above, but what did they successfully do? As you can see, kind of down towards the bottom third, this kind of gives clients an idea of the rating scale. So intensity. So when we look up at the very first kind of columns and rows, the 0 to 5 does mean something. They can actually look down and say 0 meant not at all, 1 meant a bit, somewhat, very strong, and extremely strong. That's the 0 to 5 scale. As far as skills used, so on that right-hand column up at the top and right-hand rows, the urge, action, and emotion skills. This is where you're rating from 0 to 7 on how you did with the skills to cope with all those things in the previous columns. So if you look, it's kind of interesting. This is really researchy wording that, in fact, can probably be very confusing to clients. That's why, making sure there's a lot of education when doing a diary card and not just throwing it at a client. But for example, if they put down a 0, it means that they did not even think about or used a skill. Number one is you thought about it, you didn't use it, nor did you even want to use it. This gets clear down into like 5, 6, and 7, which is you tried or you could use them and they did help. 6 is you didn't try but you used them and it didn't help. And 7, didn't try, used them, and helped. So a lot of kind of weird language in some ways, but it's getting clients to pay attention that they actually maybe tried them, but it didn't help certain skills. So again, this can be very confusing, and so making sure to walk clients through this. But it is a way for clients to also begin to realize that part of using skills is that you at least realize that maybe you tried but it wasn't helpful, or you tried but you couldn't use it at the time. It just didn't seem to fit, whatever the case may be. And then finally, how often did you use the skills? So you then would keep track at the very bottom of the card whether you use skills daily, 2 to 3 times a week, or just once a week. The reason for the diary card, for those who are kind of moving in this direction of maybe kind of using some DBT skills or going into maybe being certified in DBT, is you have the client bring back this diary card to each session, and then you really use this card to guide your session. And you dissect this card and deconstruct this card with the client in, I would say, a very solution-focused way to figure out where kind of some of the areas, the strengths were, what are some of the areas that seem to be struggles, but how did they obtain those certain numbers? I believe that you can do this in a very strengths-based way, solution-focused way, but this pretty much would guide the whole session. In fact, this diary card would then lead you to do a behavioral chain analysis to then help the client see that in the up and coming week, you can use the diary card to then help them create a behavioral analysis chain and develop a new, healthier chain for the upcoming week. So very structured, very linear, and for many therapists and for some and many clients, this is very, very helpful to have the structure in place in order to make progress, evaluate progress, and to be held accountable. And that is the dialectical behavioral therapy card. These are some of the core components of DBT that is just so important to have the clients be doing actively. This isn't something that's just, it sounds good, or the chain analysis is just merely, it's an activity that you can do. If you're doing dialectical behavioral therapy, or if this is something that you want to head in this direction, these components are essential to DBT, so I strongly encourage using them effectively and using them to guide your session and to hold clients accountable, and not merely just have this as some kind of nice activity, but actually an activity that can be used to measure change and measure progress over time, which can be very helpful to the client and the clinician.